So why did I choose to become a practitioner? I'm not sure that I did. I think it might have almost chosen me. I went through a point in my life where, well, it's a relatively bad point for me, first world problems realistically speaking, but I sort of dug my way out of it and did a whole lot of learning about health. And that was part of the thing that I was doing. It was personal growth, and a lot of that was nutrition and exercise and just learning how to be healthy and human. And it kind of got to the point where my friends they'd almost pay me to shut up and stop trying to solve their health problems. And it just occurred to me that people would pay me to do this, and I could do it. So I went off and started studying, and the rest is history. Functional medicine hasn't been a conscious thing that I've created. It's been an evolution of what I think healthcare needs. So I started doing consults in the standard way, and then realised that there's a lack of support between consults, and I am not able to provide that. And so the answer I felt had to be health coaching. And then it's evolved from there to delivering what I think is the best care that we can possibly deliver patients and what I think that they need. So I don't think health is done right. I think that the model now is based on problems of the past, and the medical problems that people typically faced, historically speaking, were more acute problems, and acute problems needed acute care. And so we need big hero interventions, we need big medications, we need surgery, and the standard model does it really, really well. But most of the first world problems now are chronic, and the system doesn't work. And I think it doesn't work because people aren't given the time. We're treating symptoms and conditions, we're not treating patients. The only way you can do that is if you understand patients, and that means taking time. And so I think that the whole model needs to change, not for everything, but for chronic cases. And so this is a way that I think it can be done. I'm sure it's not the only way, but I think it's a good way, and I would be very much interested in seeing if we can try and change the way health is done, more broadly speaking. So, functional medicine, it's not a modality, it's a methodology, it's just a way of thinking. And so functional medicine is really just understanding the human body and being able to understand the relationships between everything that's going on. So then we can, when we understand a patient, instead of applying an algorithm approach or a protocol approach, when patient has this, do this, it's try and understand it all together so that we can work out what's going on. And that way you can treat things that are going on with patients that don't have a label. And the part that I like about it is that it's marrying up the ideals of holistic healthcare, and so the ideals of tradition, with our modern understanding of how things work. And so it's the aim of resolving underlying complaints through the lens of a modern understanding. And I just think that's the way that health should be done. So like all practitioners, you end up being best at the things that have plagued yourself. And so I have celiac disease. And so, surprise, surprise, my area of expertise in particular is the gut and autoimmunity. They're my two things. I'm driven to understand them most because they affect me the most. I've had to learn deeply about those, and so they happen to be areas that I'm interested in, and therefore my areas of expertise. The cases I like are the ones where we're going to change someone's life profoundly. And so that can be all sorts of cases, but often it's those complex cases where people haven't been able to get help elsewhere. And I think there's always an answer. It's just about a matter of asking the right questions and thinking about it in the right way. The cases I like are the cases where the patient walks out feeling like they're understood, and then we achieve change for them, and that's why I do what it is that I do. Well, I don't know that answers your question directly in terms of a fact about health, but the thing that I think surprises people the most is how simple it can be and how wrong they have been in looking in the wrong places. And so what typically happens is I find that people have had health change at a prior point in their life. And then they've had results by doing something. And so an example is I've had some gut problems, so I changed my diet and I got better. And then the implicit assumption is that next time I have health problems, then diet's going to be the solution. And so patients can find themselves in really not very good condition health-wise, and they've been trying relentlessly to fix it through diet. And that's not always the problem. And so it's looking in the wrong place and spending more and more energy in it, not getting results. And so the thing that I think people need to understand is that health is more than one aspect. It's about all of the different aspects of your health pulled together. And if you're ignoring an area completely, there's a really good chance that that's where the problem is. And if you've been paying a whole lot of attention to one area and you're still not right, probably trying 5% harder or squeezing a little bit more efficiency out isn't going to make a 90% difference. It's a combination of all of that, really. The people looking in the wrong places because either they've been consuming the wrong information, or they're not willing to look in the right place, because sometimes it's hard. If we're talking about weight, for example, we typically look at weight as, well, I'll change the food that I'm eating and I'll eat less and then I'll do more exercise. And people can do this and keep on doing it and the weight doesn't drop off, and all we do is we just try and do the same things harder in a slightly different way. And if the problem all along is that your body is wanting to hold on to weight, then you're never going to get the result until your body doesn't want to hold on to the weight anymore. That means it's a hormonal problem. And so we need to be looking at hormones. And if hormones are being driven by something else that's going on in life, so there's a pathogen, or there's toxicity, or there's a whole bunch of stress, then the problem wasn't diet, and therefore it's never going to be fixed up with diet. So patients who are considering working with us, what I will always do is I will try and tell the patient what I think they need to hear, and that won't always align with what they want to hear. And I think that's my duty, is to try and figure out what's really going on. And only by doing that are we going to be able to get results. And so patients need to come understanding that the solution won't always be the place that they're looking for. So the other thing that I would tell patients is, we're not wizards. We're not going to fix your health for you. You're going to do that. We're just going to guide you in the right direction and put you on the path. But we can't change for you. And in order for you to get a different result with your health, you're going to have to do something different. There's something you're not doing that you should be, or there's something you are doing that you shouldn't. And so we have to have change. And the change is going to come from you, and we'll guide you there. So patients' stories and their journeys are always dramatically different, and I get a different buzz from each of them. Some of them, it's patient been struggling with their health condition for a long time, trying all sorts of different things, and in the end it's incredibly simple. You just make a minor change and everything clicks into place. They were deficient in a nutrient, or it turns out they're having a problem with the food. We identify that and they're all good. And I love that, because it means there's minimal imposition on their life, and it feels good to solve a case.